Hello everyone, how are you guys doing? This is Esther here from Shujo Aesthetic Skin Clinic. Hope you guys are all doing well and your families are all keeping safe. In today's topic, I'm going to just quickly jump in and talk about acne. And the topic we're going to be talking about today is just not acne occurring on the face, it's acne on the back. So back acne or bacne, and how we can effectively manage this condition. A lot of you might have acne, or you know friends that suffer from acne, and usually the acne will be on your face, and maybe you've had it as during your adult years, or you have actually developed hormonal acne now that you're sort of older, between probably 25 to even older. Sorry, I'm just going to adjust the slides. 25 to Hi guys, thanks everyone for jumping in. So basically, but in terms of the face, in terms of the back and chest, acne on that area is can be managed differently because of the way that one, the distribution is on a larger body surface, and also the fact that the skin on the back as well is a lot thicker than the face that's on the skin, that the skin on the face. So in terms of managing acne on the back, the things that I will usually advise for clients to be able to do is to make sure that they get a good wash, which is because it's a larger body area, to be able to use things that contains benzoyl peroxide. And as we know, benzoyl peroxide has got both anti-inflammatory and antibacterial properties to be able to help to unclog the pores, as well as kill the acne causing bacteria, which is the C. acnes causing bacteria. So by using benzoyl peroxide, you can actually wash, I would say benzoyl peroxide wash, you can actually help to target those areas. And you can start by using percentages from between 3.5 or to 3 or 2.5 to actual maybe 10% of benzoyl peroxide. There are different preparations and different brands out there that do different things. So I would say start off by using smaller percentages, and then sort of build up your body resistance. But because it's on the body, you don't get the same form of irritation that you get usually as you were, if in case you are using it on the face. So the irritation is going to be different. Another thing that you want to also consider is, while using benzoyl peroxide, just know that it can stain your clothes. It can actually bleach your clothes, so just bear that in mind. So when you're applying it, that's why it's also good to have it as a wash as well, as opposed to just applying it topically on the body. So that is what I would definitely advise. But another thing that you can do, even if when you are applying it topically, just make sure that you are aware that when you apply it on the body, that it can actually bleach your clothes. So just be aware of that. It can also cause drying effect on your body. That is one thing that it's going to do. So you want to also make sure that you're locking in moisture with the benzoyl peroxide when you are using that. So if you are using let's start, for example, with the wash as well. If you're using a benzoyl peroxide wash to target your back acne, for example, you want to also be able to leave it on the skin for for maybe 3 to 5 minutes, so that it will increase the penetration it has on the skin. Because like I said, the body, the thickness of the body is different from the skin, so you can actually leave that benzoyl peroxide on the body just before you go and have your wash, maybe 3 to 5 minutes before you have your wash, and then you can wash it off when you're in the wash. You also want to be able to make sure that you're applying sort of a thin layer on your body as well. If you are using the cream, benzoyl peroxide cream, just apply a thin layer. You can get those sort of applicators that will help you to apply creams on your back or your chest area, or you can ask somebody to help you, maybe ask a person to put on the gloves, and then just help you to smear that at the back area. So that is really going to help. But just make sure that as much as you're doing that, you might experience some form of peeling effect or drying effect or over drying effect of the skin. So make sure that you're locking that moisture back by using a good moisturizer that has got lots of I will always advise things like CeraVe products because they've got salicylic acid, they've got hyaluronic acid, and some of them have got a combination of lactic acid as well in them. I could actually leave some links below for you to be able to get, and you can get it off the counter as well. Maybe I think for places like Boots you can get some CeraVe products, and they're quite big as well, so you can, that is actually going to go a long way for you because it's going to help both to moisturize the skin, but it also has got lactic acid and hyaluronic acid and some salicylic acid as well, which is going to also work well with the benzoyl peroxide that you're using in conjunction with it. So that will actually increase the efficacy of the benzoyl peroxide. So that's one way. But in terms of those sort of cystic acne, those kind of painful, big, painful acne that has got lumps or nodules, for those ones, you definitely do need to refer to a dermatologist or a specialist practitioner like myself to be able to make sure that that is well diagnosed and well looked after, and then proper interventions can be made to make sure that that is not then leading to other problems like scarring and all that. You might need either maybe a topical prescriptive treatment, or you might need a combination of oral antibiotics or other sort of remedies or in-clinic treatments that is going to be able to help, because with those ones you definitely need a specialist referrer to be able to help you with that. So it's very important that you don't try to DIY that. For normal comedones or white hairs or black hairs that are that are common, you can definitely do some DIY by using over-the-counter remedies or benzoyl peroxide, like I said. But for much more serious and severe acne that has got nodules or cystic acne, then definitely you do need some specialist referral for that to be able to help you with some prescriptive topicals or a combination of that and antibiotics. Okay. Other remedies that you can do as well is to be able to make sure that you are really maintaining a good hygiene routine, especially if you're an athlete or somebody that works out or you go to the gym on a regular basis and you're sweating. Sweat, moisture, warmth, and all this sort of thing don't work well with bacteria, because the more you have that, then the more the bacteria is breathing. So make sure that if you're somebody who's gone to the gym, with that heat, don't start putting back the wet clothes. Try to get out of those wet clothes as quickly as possible. Don't linger around with them, and make sure that that body area is you can get it a clean towel or wipe, and just clean that area as quickly as possible so that bacteria and everything don't build up with the warmth and the heat as well. So just try and everything that you can do to try to mitigate that, to make sure that if that surface area is clean. Another thing that you don't want to do as well is to irritate the skin, or to overly irritate the skin by either over scrubbing the skin, or you're not moisturizing the skin. Remember, like I said to you, the benzoyl peroxide and all these other things that you're going to be using, tretinols or whatever, they all have drying effect to the skin, and they can as well irritate the skin, though it's not going to be the same as the skin on the face. However, it's still a skin. So make sure that you're locking that moisture back into the skin, and then you are not overly scrubbing the skin. Or some people really go hard on their skin, the skin on their back, and they really irritate the skin. Acne does not like irritation, because remember, what causes acne is a form of inflammation, and if you have an irritated skin, the skin is easily inflamed, and then you have acne. You're just going to make your acne worse. So you don't want to be doing that. Okay, you don't want to be doing that. And so, like I said, keep this area clean. Make sure you keep a very good hygiene routine, especially if you're somebody that go regularly to the gym, or you work out, or you sweat, or you must make sure that that area is very clean. You're keeping that area clean at all times. So those are some of the little tips that I have to be able to way off making sure that that back or chest area is looked after. Another thing that you can do as well is to in clinic treatments will be obviously things like chemical peels. There are some good home remedies as well that you can use, or chemical online peels that you can use in various percentages as well. You know, just sort of apply things like salicylic acid on the back, which is a peel. But I wouldn't say go and start trying things that you're not used to. Make sure that you're somebody who knows what you're doing in terms of chemicals, because remember, they're chemicals, and if you don't know what to do with them or the percentages that are safe for you to be using at home, you don't want to risk and get yourself into trouble. So if you're not sure, just go to your dermatologist or go to a specialist practitioner who knows exactly what they're doing and how to use chemical peel for your skin type as well. Remember, ethnic skin, Caucasian skin is different when you're applying chemicals on them. Ethnic skin is going to irritate more, and that irritation is going to cause hyperpigmentation more, okay, more risk of hyperpigmentation. For Caucasian skin, is much more easier in peel applications without more, though they can still have issues, but it's not as crazy as, you know, with Caucasian, with ethnic skin. So please don't do any sort of DIY peels that you're not, you are not trained or happy to do. Like I said, in terms of things like benzoyl peroxide, you can actually use it as a mask. If you have like a cream, you can apply it on that surface area and leave it for sort of 5 minutes or 10 minutes, and then you wash it off, because it's going to help with penetration. That penetration is going to be increased, as opposed to just using it as a wash, as a body wash. It's going to also help with the penetration, leaving it there for a couple of minutes before washing it out. So hopefully that helps, but just remember that no matter what you are using to manage acne, it's going to have a drying effect on the skin, okay? Whether you're using salicylics or you're using benzoyl peroxide, tretinoin, anything like that, is going to have a drying effect on the skin. So remember that your skin is going to go through these changes. It's going to look dry. You might even have purging of the skin, which means that your acne might actually look worse before it starts looking better. It can cause irritation to the skin. So what you want to do is to make sure that you're locking moisture back into that skin. Don't let that skin to be overly dry. Even if you have an oily skin, you still want that skin to be moisturized and hydrated, all right? For you to have an oily skin does not mean that you don't have to still hydrate your skin. That skin still needs moisture, but the thing is knowing the type of moisturizer to use that is not going to then clog your pores, okay? But if you commence any treatment for the management of acne, be it salicylic, prescription or non-prescriptive, you're getting it over the counter, those things that's got those actives, so like I said, salicylic, glycolics, all those sort of things will have a drying effect on the skin. So you want to be able to make sure that you're balancing that oil, that moisture back into the skin, because the transdermal water loss is going to be more increased when you're using those sort of active ingredients in skincare, okay? So yeah, I just thought I should just sort of jump in. Hi Sita, hi Amanda, hi Sophie. How are you guys? Hope you guys are all doing well. If you have any questions in terms of acne treatment, back acne, chest acne, facial acne, hormonal acne, please feel free to call me or contact me at Shujo Aesthetics. Though the clinic is closed at the moment, I'm still doing virtual consultation for my clients, and we can, you know, do WhatsApp video calls. You send pictures, we review that, and then we can arrange a proper consultation for yourself. Go through your medical history, drug history, allergies, and everything to make sure that anything that is recommended for you is completely safe for you. I'm also doing prescriptive skincare as well in terms of compounded skincare. So what's the difference between a normal prescriptive skincare and a compounded skincare? A normal prescriptive skincare product is a skincare product that is already there. It's got a prescriptive, it's got prescription ingredients in it, for example tretinoin in various percentages, or you know, other ingredients that are prescriptive. And that is probably by a brand, and it's been prescribed, or you can just, the doctor will say, you know, write it down for you. You can just pick it up from a pharmacist or something like that, okay? Or from an aesthetic clinic, is prescription, okay? Now, for compounded ingredients, compounded prescription, which I do, is you come to me we'll go through your medical history, go through your drug history, go through your skin consultation and everything, and we identify the different issues the same way you would do normally. And I would then look at your skin needs. You have a bit of hyperpigmentation, you've got a bit of acne, you've got uneven skin tone, you've got this, your skin is sensitive, so we weigh up the different. It's got a bit of dryness, a bit of anti-aging there, a bit of this, a bit of that. So I would then work out a compounded skincare ingredient for you. So I am basically prescribing the actual ingredients. So let it be 3, 4, 5, 6, 7 ingredients. I would depending on what ingredients that I want for your skin, I will identify them. Yes, ingredients. I will identify the percentages of those ingredients, okay, that will give us that efficacy, that will give us that, for us to start seeing results, okay? It's not just getting a normal thing over the counter, it is me looking at your skin and say, okay, hyaluronic acid, I need a lot of plumbing on your skin. I want to give you 2%, 3%, 4% hyaluronic acid in this ingredient. I want 20% vitamin C. I want some glutathione in there because I want some, I want some niacinamide. I will give you 4%. I'll give you 5%. I want, some vitamin C oil in there, 1%. I want, some tretinool in there, 0.25, 0.5, 1%. I want, so I am looking at you as an individual and I am making the bespoke ingredients for you. For example, you're allergic to one thing, we're not going to put that in. Well, your skin is a bit sensitive, I'm going to put something else in as opposed to maybe this. I'm going to put maybe azelaic acid as opposed to, benzo. I'm going to put this as opposed to this because I am looking at your skin and all that. I want some lightening ingredients in there as well because I want to also target your lightening, your pigmentation all at the same time. So it's completely bespoke. So I will write everything down, all the ingredients. I will write the percentages of those ingredients that I want for you. That information with your details is going to go to a pharmacist, a compounding specialist pharmacist that I work with. They will then prepare that specifically for you from scratch, okay? It's going to be compounded. So it's nothing that you just go and pick up or from a brand, no. So they will prepare it and then send it to you. So when you receive it, it's nothing fancy. It's just going to come like so. So all my skincare ingredients that I use at home for myself, all are compounded. So it's going to come something like this. It's nothing fancy. I don't do brands. It's just going to come with your name and your date of birth, and you're also going to have the ingredients, the active ingredients. Let me show you. So basically, it's going to come like so, okay? It's going to have the active ingredients in the skincare. All the active ingredients is going to be specified by the pharmacist that is being used, which I have prescribed. It's going to tell you exactly what those does for your skin, why it has been added to your skincare. Let's say, for example, this one I've done is high potency antioxidant serum. So for this one, I've got hyaluronic acid 20%. You cannot get that anywhere. It's got vitamin C 25%. It's got vitamin E oil 1%. It's got alpha lipoic acid 5%. It's got glutathione 10%, niacinamide 10%, tranexamic acid 5%. So that is my skin. Okay, that is for me. So that is this little bad boy here. So that's for me. So that is my high potency serum because it's giving you the best of everything. So that is why it is completely bespoke. It's not like if you were all these ingredients here individually, if you're going to buy it individually, it's going to cost you. You are spending mega amounts of money buying all those hyaluronic acid 10% individually in a serum, vitamin C 25% in a serum. So each of them will cost you anything about £65 40 pounds, depending on where you're getting it and depending on the brand. So that is why I decided to do bespoke compounding skincare. Glutathione that I have here is 10%. Niacinamide is 10%. Tranexamic acid is 5%. So you cannot get those sort of ingredients anywhere, basically, as far as I'm concerned, because and I know how much you'll be spending if you are going to be buying all those ingredients as individual brands. Okay, so that is what is called compounding skincare. So it will come there and you will have all the ingredients. The pharmacist is going to list all the ingredients there and the various percentages as well, and what all of them does for your skin and the benefits it's going to have for your skin. So what I was saying, that it's going to come in a prescription form. So you are going to have, so you see that prescription. So I will have your date of birth, your name and everything, and I'm going to list all the ingredients and send that form to the pharmacist, and the pharmacist is going to, the compounding pharmacy is going to then prepare that for you. So for me, that is the best way of looking after my clients, because they're getting bespoke treatment from me. The ingredients that they're getting is nothing that you're going to get anywhere. If you want to get all those ingredients individually, you're going to pay thousands and a lot of money, basically. But I make sure that the ingredients I'm compounding together are safe. They work well with each other, and they've got the right the right percentage for us to be able to get the good results that we want for your skin. So that's the difference between a normal prescription skincare or ingredients and a compounded ingredients. We know that, for example, tretinoin would have is a prescription skincare, but with compounding, we know that tretinoin can also cause irritation. Like, for example, this is my bit here. We know that tretinoin can cause irritation to the skin. So for compounded skincare, I can then choose to put tretinoin with some niacinamide and some hyaluronic acid and some vitamin E and some, so I can choose to put other ingredients in there that is going to make it, one, work better, but also obviously less irritable for the client as well. So that is way compounding skincare works. So if you're somebody who is interested in that sort of skincare products, please let me know. All we need to do is to do a virtual consultation. We'll go through everything with you, and we can then get that compounded for you. The pharmacist is going to send it out directly to you, and then you start using your products, and we can then review you on a weekly basis. Okay, all right guys, love you, and I'm going to leave you guys here. So if you have any questions, so get in touch with me, and take good care of yourself, and God bless. Bye bye.